anything that you need to share, please let us know. A reminder, if you're joining by phone or computer, please keep yourself on mute. If you're joining by phone only, you may need to hit *6 to unmute yourself. We will go ahead with the roll call. Shelley?
Brian Smith?
Here.
Chris Salvino? Dale Woolridge? They couldn't make it. Dan Spate?
I'm here.
Thank you. Deb Garambe?
Here.
Edgar Bissonette? Franco Castramarin?
Here.
Gail Bradley?
Present.
Garth Gamer?
Present.
Glenn Kasperzik?
Good morning, present.
Heather Miller? Howard Reed?
Here.
Steve Gottanker?
Present.
James Hayden?
Present.
Nicole Costanza? Rod Reed?
Here.
Roy Royal?
Here.
Sarah Parati?
Present.
Shari Brand?
Present.
Stevie Miller, or Stevie Merrill, sorry.
I'm here. Thank you.
Todd Jaramillo?
Present.
Vince Martinez?
Present.
And Vivian Gellert.
Present.
Hey, Shelley, Heather Miller's on the phone too from Kingman.
Thank you, Heather. We have forum.
Thank you. And just a reminder for everyone who is part of the committee, we do request that you either come up verbally for forum purposes or you type in the chat if your microphone is not working so we can gather your attendance. So we do have a quorum. In your packet, there is the attendance report. Just a reminder that if you miss 2 or more consecutive meetings, you will be contacted by the Bureau to determine if you're still interested in sitting on the committee. We have several, we got a few new members. So first, which I think was going to be here, but we don't see yet, I wanted to welcome Nicole Costanza, Deputy Director for the Governor's Office of Highway Safety, will be a new member to the committee. We have quite a few vacancies. I recognize that many of you in the room are part of the vacancies that have applied for those positions. Those are at the Governor's Office of Boards and Commissions, so we are just waiting for those approvals. So hopefully those will go through shortly and we can get people added to this committee formally. But we do recognize that, especially with quorum purposes, thank you for everyone being here today. We do have 8 current vacancies that we are waiting for a formal nomination from. I wanted to briefly touch on our FR Care grant. I know I've mentioned this previously. In the back of the room, we have Sebastian Thomas, who's overseeing the naloxone Leave Behind program here with the Bureau. We are really excited that we are getting quite close to go live date for the program. The training curriculum is complete. It is live on our website. This is available in a format that can be uploaded to your learning management system. Your personnel will get continuing education credit for participating and completing that. And it's a very well done brief training curriculum. In regards to the naloxone Leave Behind kits themselves, we should have those ready for distribution for agencies that would like to participate within the next 2 months at the most. The kits themselves are going to contain a few items, one of which is going to be the actual naloxone, and we'll have 2 doses of the naloxone intranasal dosing. There will also be a information sheet for the patient or anyone who's with them on how to recognize the overdose and how to administer the naloxone. And then there will be a resource guide that is specific to your geographic area or jurisdiction. So one of the things that we have worked on with the Center for Rural Health and University of Arizona is to gather resources that are very specific to your area to ensure that if patients with resources with substance use disorder, medication-assisted treatment, or other resources, that we have those available for your area as well. So those will be available. Once this is ready to go live, we will send out formal notifications. If anyone would like to start their training in the interim before the kits are prepared, let us know. We can get you signed up with a link for that as well. Sebastian's information is readily available, or you can get a hold of me and I can put you in touch with Sebastian. Any questions regarding that? All right, thank you. I will turn it over to Chief Garcia for the Bureau report.
Thank you. We have some very special guests in the room with us today, and we are going to get to introducing our special guests and recognizing them in just a moment. So I am though going to spend 5 to 10 minutes, maybe more like 10 minutes, going through some slides quickly with this group to make sure we're providing some updates from the Bureau of EMS and Trauma System today. Fossil, if you are on the line and you are game for going through the EMS annual report and 911 call volume dashboard briefly, we'd love to engage you and get through this relatively quickly. I do want to say that we'll go through these slides and we will send them out shortly. And so everybody will have this information in much more detail, although we'll go through it quite quickly. As we get started, I want to share with you all that we are taking photos today, just so everyone knows, and we will be inviting some of our special guests for some photo opportunities here up at the front. One of the questions that we've gotten as we've prepared our Bureau report is to share an updated organizational chart for the Department of Health Services. You can see here, although the text is quite small, we currently have an interim director, Jenny Cunico. Under Jenny Cunico is the Public Health Services Division. And for awareness, that is where the Bureau of EMS and Trauma System, the little blue star you can see there, rolls up. If you have any questions about our org chart, please let us know and we're happy to clarify. Some legislative and rule updates. If the clicker will allow me to advance to the next slide. We do have a number of bills that we are tracking. And several that are starred here for folks that would like more information. We have provided links to these bills for further review. The 3 that are starred will require that the department conducts rulemaking to update ambulance certification and training rules to go into effect by January 2024. We will make sure that all stakeholders are aware and informed of that rulemaking process. We'll be sharing information on our website. And allowing, of course, stakeholder comments and following up with you all as we move through that process. We have posted draft trauma rules. Those are on our website and available for comment through May 21st. There is a link here for anybody that is interested. We also wanted to make sure we were sharing resources on the end of the Public Health Emergency Declaration and Title 42 at the federal level. For our regional council partners in the room, we really lean on you and we'll be working with you on any updates or resource requests that may potentially come through. And please know that we are a resource if you have any questions at this time as we navigate the end of the Emergency Declaration and Title 42 specifically. Next slide, if it will let me. Excellent. Thank you, Shelley. I want to give a shout out to all of the regional council partners that have continued to work on the EMS and hospital collaborative patient offload plan. This continues to be a best practice example that has actually been recognized by other states. We've received several inquiries into some of the work that has been done across the healthcare spectrum to improve patient offload and out of service times across the system. So thank you very much, and we're happy to share more information on that if there are questions. Today and this month are very special to us because it is National Trauma Awareness Month, and next week in particular is EMS Week. And so we are very pleased to be able to take some time today to recognize many of our EMS and trauma providers across the state. In particular, in preparation for EMS Week, Governor Hobbs has issued a proclamation for May 21st through 27th. I think you might be able to see on the slide that May 26th in particular is EMS Recognition Day. And in honor of EMS recognition, we look forward to announcing the 4 emergency medical care technicians of the year that the department and the 4 regional EMS councils were able to recognize, and definitely look forward to hearing more about the 4 winners that we have with us in the room today and recognizing their outstanding work. In honor of National Trauma Awareness Month, there was also a blog that was recently published to highlight this month's theme, which is roadway safety is no accident. Everyone plays a part in making sure that our roads are safe. This blog and posters around the department have Arizona crash facts, and we want to continue to make sure we are recognizing our trauma providers as well. And we look forward to also developing a trauma program recognition awards moving forward. Some additional slides that will be shared and sent out to all of our participants today highlight BEMSTS version 3.5 reporting requirements. And we want to make sure that all of our licensed providers for air and ground agencies do know that BEMSTS version 3.5 goes live July 1st. And all licensed air ambulance agencies in particular are required to report by July 1st under our new rule set that has been published. Opportunities for stakeholder input. I think we've gone over some of these already, but just want to remind folks that there is a needs assessment being emailed to all agencies across the state for participation. We have links to our draft rules for public comment. And additionally, you'll have links here to ADOT's 5-year construction program that is seeking public comment right now, as well as a notice of funding opportunity for safe streets and roads for all. That funding and applications are due by July 10th for any municipalities that may be interested. Some additional slides on SHARE and cardiac registry program updates. Julia Vinton, I am not going to do this justice, but I'm just going to say that if you do have questions, please reach out to Julia or Dr. Bradley, and we have other folks and partners in the room today that have some information on the program as it moves along. We also have naloxone leave behind and national registry updates, and we'll make sure to circle back to those if folks have questions. TJ, please stay with us if you have any additional updates on national registry. But Boswell, if I may, I'd love to turn it over to you next. If you can take us quickly through the EMS annual reports and 911 dashboard updates.
Sure. Thanks, Rachel. Sherry, can I share my screen?
Yes. Oh, that presented.
So this year, what we have done is we are transitioning to dashboard data from our annual PDF reports. So we no longer would be doing an actual hard copy PDF report, but we will be this dashboard will get updated every year as soon as the data comes. And so right now, the 2022 data is already in the dashboard, and as soon as after this meeting I present it, I'm going to send it for the approval, and it should be on our website no later than, I would say, in 2 weeks. By end of this month is my target, is that it should be up and running on our website. What you see over here is just a snapshot of your 22. I'm not going to go into the details of this. You guys have seen the annual report. It's very similar to that, but I want to show you some of the features. Is that over here there is a drop down box for the year, and at a time right now there are 3 years. I'm going to that is a capacity to handle more than 1 million data in each year. We are right now, it is just limited to 3 years. So if you change the year, and it will give you, it changes, and it will give you it changes the numbers, and for the 2020 you can see what was going on. But I'm gonna keep it here steady at 2022 year. Yes, Chris.
Chris, do you have a question? You had your hand raised.
I apologize. Okay. That was not intentional.
Not a problem. Thank you.
Okay. All right. In the next page, what we are looking at is pre-hospital incidents and volume. Again, we have the feature to change the year. And another cool feature is that I know that usually what we do is all the agencies together, whether it is air or ground. But over here, you can now select. You have the ability to select either all, which is combined, or air and ground. So we can see what's happening with the air agencies if they want to adjust the report only for air, and then the whole report changes for the air agencies. Another filter is I want to just know 911 response, or I want to know about just in the facility medical transport. Then I can choose that and see what was the distribution happening, and also by the EMS region. So there are many filters are included. So the entire report then you can see for, if you just want to see, okay, in northern region for 911 response I want to see, then you can select those two and then get the numbers out. The third page, fourth page actually, is about the demographics, by age, gender distribution. We have the county rates over here, and then county is also divided into urban and rural to show the magnitude. So if we see that in the rural section, even though the percent of call volume is less, like it's 15% compared to urban, if we look at the rates, there is not much, it's like pretty high in both rural or urban. So obviously the volume wise, we are going to make up in the urban because of the population, but the rate wise, if you see, there is not much difference between that. Then we have captured some of the primary and secondary impressions of interest. So that does not mean that they make up for the large volume, but these are some of the primary area of interest the Bureau and the stakeholders had, and then we chose some of the injuries. So we have few things over here for you guys to select, like cardiac arrest, opioid, seizures, STEMI. Right now the injury is displayed. It gives you what is the count, what the mortality is, what is the age distribution, and in the mortality side, what is age distributions, and then the rate by county, so we can see which county is significantly higher compared to other. But this is the rate. We have done the rate and not the actual volume over here. But if you put your mouse, you can see, okay, how many total number of cases. The rate is 4,000, but the number of cases are 8,975. Just one quick thing over here, mortality is that if you see, we have included died in hospital, and that comes from hospital discharge database. That after linking the EMS database with hospital discharge database, we have pulled the mortality numbers over here to give you guys a accurate picture of that at scene. It's only 1,000, but then another 1,600 also died in hospital when the impression was injury. Then comes the injury types, because injury is a very broad categories, and as a Bureau we also have a trauma registry going on. So I thought it would be nice to see, okay, what types of EMS the injury distribution EMS people are seeing, so we can see the types of injury, and then again the mortality by the types of injury, and then again some demographics for those, age, gender, and county rate. Then the last page is about the response times, and again you have the flexibility to choose the year over here, and that's the only flexibility we have given over here, is to filter is year, because some of the filters are included already in the graphs, but because of the volume we are not able to give some other filters. So if you see the response time, this is the median response time for, it is already limited to 911 and ground incidents, so ground agencies. So it's already limited to this. The information about the air has not been given, and the median response time is mainly for the ground incidents. It makes more sense, and for 911 call. So, and then the distribution is by county. We can see that there is not much difference between the response time, as well a couple of counties are coming up high, and the counties are again grouped so that we can see the central region, northern region, southeastern, and western region. So most of the filters are included in the graphs. Then the next is a median scene time, and the scene time is again only for 911 and ground incidents, and only scene time is only when they are transported to the hospital. Then only the scene time was calculated. Scene time and transport times both are only for those cohort of the patients when they are transported to the hospital. What we see over here, one thing is that I want to point it out is, if you see the median response time, the response time data missing is only 0.2%, whereas the scene time, we do have some data missing issues, 14%. And if I see the transport time, the missing is 20%. So we do have some missing data in both of these times. And now the scene time, we divided the graph by the some impressions, because I think that's where we will see some difference. By county, we are not going to see difference in the scene time. That does not make sense. So we didn't do it by county, but we did it by the impressions. And again, the transport times, again, it makes sense that we do it by county because more rural counties, it takes more traveling time. So it makes sense that, okay, let's do it by county to see how the transport time is differing, from urban, rural, or from region, to figure that out. So that's, I think it cover it. We have tried, I think, to cover almost the entire 911 annual report into the dashboard. The one good thing about this is that as soon as the data for the 20 of the last year is ready and the hospital discharge data is also available for me to get the outcome mortality, this gets updated, and we can present it to you guys way early than what we used to do it previously. Is like in September or October, we used to give you guys the report for the last year. Now it is already available. I think someone has a question. Eric, yeah, I think I'm done with the EMS dashboard. So let's take a question first before I go to 911 dashboard.
Yes, thank you so much. As an EMS medical director for over 16 years, this is the best access and availability and organization of data I've seen from a state in my career. So I want to say thank you for doing this hard work and giving us this information. It's really going to help. A couple of questions. When you have the impressions broken down, like for example, when we look at the STEMI data, is this STEMI as diagnosed by EMS, or are these hospital confirmed diagnoses of STEMI?
Yeah, Eric, that's a pretty good question. This is, except for mortality data, everything is EMS.
Okay, so there's a potential for some overcalls there and some cases being missed in that STEMI pool. Okay, it's good to know. Thank you.
So Eric, this is exactly my reason is that, if this kind of exploratory analysis can be done through the dashboard, and then we can together, if you guys then want to go into detail of some things together, we can then figure it out, some other supplemental reports or just the individual reports for those matter. But this kind of just gives you an overview.
That's perfect. No, it's good to know. Thank you. When we look at specific impressions and in the local regions, are we able to historically go back week by week, at least using the dashboard that was up previously? It showed you like the past week, but I couldn't find a way to see the prior weeks. Is there a way to do that?
Well, let me see if I understand the question. In this dashboard, you are talking about it, Eric? Or we are talking about different one?
Looking at the weekly data report, does it show you just the current week's data, or can you historically go back and look at prior weeks?
Oh, so I think we are now jumping to, we are jumping to
So,
this.
Dr. Cooper, we can maybe come back to that question and just make sure we don't have any other questions about the first one. So this is a substantial change for what the Bureau has done for well over, I think, 10, 15 years. Previously, Vatsal and her team put together a EMS annual report, which was a PDF document, and that was published on the department's website. This is going to be moving forward, as Vatsal mentioned, much more real time, but also allows the end user to hopefully go in and navigate through the data and pull things up as they feel is necessary for them. So we just wanted to highlight that this is going to be a change. We have essentially sunsetted the old format, which is going to be that PDF version, and we are moving towards this online Tableau dashboard that she has created. So before we go on to the next question regarding the active 911 dashboard, I just wanted to see if there's any other questions for Vatsal regarding the EMS annual report dashboard.
Yeah, I have one last thing. Any chance you can add sepsis to those listed diagnoses, since the EMS mortality is so high for that? That was my last one. Thank you so much.
Sure. I think we can talk about that. Yeah.
Thank you. Thank you. Any further questions on that piece? All right, next we will go to the second component, the 911 call volume dashboard. And I think Dr. Cooper had a question regarding that one as well. Vatsal, if you can bring that one up.
Sure. Okay. So this is real, kind of almost a real-time data. That was what I showed you was a 1 year combined annual report. But this goes to call volume on May 16. That is like just 2 days before, what was the call volume. And if you see, we have a call volume of 2,000. When I say call volume, it's the number of cases reported to AZPers. That's what I'm talking about. So that's on May 16 was 2,553. And I just did a mental math in my mind is that we have 1,400 some minutes in 24 hours. And that is like 2 calls every 1 minute, so that's such a significant work is done by our EMS community over here. And so that over here we have a call volume last week, and that's 17,000 for the entire 1 week data. And we can see the last week call volume, and for again some of the primary impressions chosen by the Bureau, which is like kind of time sensitive, and falls and motor vehicle crashes. Those are the two basically primary injury, what we have seen in trauma registry. So we decided, okay, let's see even the EMS side, how many they are treating it, pre-hospital field. So what you see over here is a last week call volume. And now if you click over here, click to see weekly average, and that this might answer your question over here, is that what we have is that you can see for each week, like in 2022, motor vehicle crash weekly is 633 cases, what we are seeing in a weekly. So if I go back over here, okay, motor vehicle crash is 549 is I saw last week, but my weekly average in 2023 for motor vehicle crashes is 633. So that gives you a little bit of comparison if you want to do the comparison, but there is no way you can go back to the historical data to figure it out. Okay, what was in the last week? This dashboard was like it's a quick dashboard to just get the impact. Okay, what is happening right now? I think that's what yeah.
Thank you, Vatsal. I mean, truly, this is amazing work that Vatsal and her team have put together. Really a resource where you can kind of look and see what data looks like. I know some of the trauma centers and agencies use this type of data for grant applications and things along those lines. So if you have any feedback or input, please provide that to us. But a big thank you to Vatsal and her team for creating both of these dashboards.
Thank you.
All right. Next, we are going to move on the agenda to the EMCT of the Year Award presentation. Just a quick statement before we start. There is going to be an opportunity for some formal photos to be taken downstairs by the state emblem. So after the awards component is done, those of you who have received the awards, if you'd like to go down to the main level, and we will take some formal photographs for you down there as well.
Yeah, and Megan, do you mind raising your hand and letting folks know she does have a camera? She is able to take some nice photos downstairs for any of the winners that are interested.
So we will go ahead and start with the northern region.
Sure. Do you want them to come up or stand, or?
We would love for folks to be able to navigate up. I know that it's very tight in the room, but if we have anything to hand out and folks can make their way up to the front over here, we do have a little bit of space.
Rose, why don't you come up and over here?
Does that bring the family up?
Yes.
Absolutely. No, thank you for coming.
Should I read the whole letter? Should I read the whole letter? Rose Blackhorse Gill, at the Bureau of EMS and Trauma System, in collaboration with the 4 EMS regional councils, hosted the first annual Emergency Medical Care Technician of the Year Award as part of Arizona's observance of National EMS Week 2022. The annual EMCT of the Year Award recognizes outstanding EMCTs across Arizona who have gone above and beyond to serve their communities. 4 EMCTs were selected, one for each EMS region, based on the following criteria: years of service, academic advancement achievements, meritorious service awards by agency or community, community volunteer service, or other achievements or contributions. On behalf of the Bureau and Northern Arizona Emergency Medical Services Council, we want to congratulate you on you being selected as the EMCT of the Year for the Northern Arizona EMS region. You were selected as this year's winner because of the following. Rose Blackhorse Gill started as an EMT for Sacred Mountain Medical Service in 2005 and worked her way up to becoming a paramedic in 2009. Rose is a training officer and precepts new paramedics. She performs quality assurance and reviews 100% of the ambulance charts. She is responsible for medication and narcotic resupply. She is a certified critical care transport specialist, and she has completed defensive driving courses. Sacred Mountain Medical Service is based on the Navajo Reservation in Tuba City and Kayenta, and Rose lives in Chilchin Bateau, and she will drive 173 miles to Flagstaff to resupply narcotics and medications, and then deliver them back to Sacred Mountain Medical Service based within Tuba City and Kayenta. Rose has been described as selfless and takes on these extra responsibilities so that her EMS crews can concentrate on their jobs and not have to worry about other tasks. It should be noted that Sacred Mountain Medical Service performed a very high number of ambulance transports of very ill Navajo patients with COVID to Flagstaff Medical Center and other Arizona hospitals, of which Rose was instrumental in performing. Rose is based primarily in Kayenta, which was ground zero for the COVID outbreak on the Navajo Reservation. And Rose is an EMS leader and provides a critical role in staffing essential ambulance services on the Navajo Reservation in support of our community. Please accept this letter of congratulations and this accompanying award plaque in recognition of their achievement. Thank you for your service to Arizona residents and visitors, and particularly for your community. You have to say something now.
Thank you, everybody. Have a nice day. It's a really big honor. I really appreciate it. Thank you and my family. Thank you so much.
Congratulations.
Thank you. Thank you for your work.
Next for the Southeastern region, I see Dr. Gates through the room. Are you doing this presentation?
I am.
All right.
All right. Morning, everybody. I tend not to be formal. On behalf of the Southern Arizona EMS Council, it's my pleasure to recognize our outstanding EMTC of the year, Brandon Mason. A few words about Brandon. Brandon has worked for Tucson Fire Department as a paramedic for 13 years now. I think if I had to sum up his work with Tucson Fire Department in a brief one or two sentences, it would be, he is the rock, the training paramedic that everybody else in the department looks up to and aims to be every day when they're out in the field. So with that, Brandon, congratulations. Thank you very much.
Next for the Western region, Rod.
Ray Brewer, come on up. For those of you who don't know Ray, it's my one of my purposes in life is to make sure he spends a lot more time up here on committees, and he's just that guy that you're going to need. You do need. So Ray, I'm going to skip over that other stuff and get to the heart of this thing. For the last 20 years, Fort Mojave Mesa Fire Department, he's now a division chief of EMS, Ray has been an agent of change in the Colorado River Valley. Born and raised locally, has seen this area grow from a small town into one of the fastest growing microeconomies in Mojave County. He went to Las Vegas Fire and Rescue Academy, but he came home and brought his experience and work ethic back. He's got a lot of things on here. The Medal of Merit by the fire department. The Elks Lodge has recognized him as a firefighter of the year. He's a member of the TEPI and the PACES committees up here. Zoll National Pulse Award winner. He represents the Western region on the Arizona Ambulance Association. He's a hand-heavy pediatric master instructor. So this is the guy when you go to the big premier EMS type shows, he's going to be the one teaching you. But the thing that I think is the most important is we get into things like he taught hands-only CPR to junior high students. And I want to see you demonstrate this Learn to Beat program. No, not right now. But the other things he's placed was very instrumental in making sure that the Stop the Bleed kit is in every classroom in his jurisdiction. He's he's an instructor for Stop the Bleed, and he's also teaches the I Live program to the teachers in his jurisdiction. That's the one with the active shooters. And he's also very instrumental in the Fort Mojave Mesa Christmas toy drive and the shop with the first responder and all that local stuff. So, Ray, good job.
Thank you so much.
Congratulations as well. And for Central Region, Roy, are you on the line?
I am, thank you. The Ames region had 7 very well deserving individuals for this award. And of course, there could only be one award made. And it was made by the complete...
So Roy, sorry, I'm going to interrupt you for a second. We're going to have I wasn't sure if you were giving it or Tracy. So I'm going to have them come up in the middle of the room and then I'll let you continue. So if you'd like to come up.
Okay, let me know when you're ready. Let me know when you're
All right.
ready.
Thank you. Don't forget. I will let you finish your intro and then I'll hand it off to Tracy to complete.
Thank you very much. It's my distinct honor to tell everyone know, and she's there with Tracy, who nominated Jim. Our EMCT awardee was Jim Cessolini. And let me read what Tracy wrote briefly in the nomination for Jim. It says, Jim is in a dual role as a deputy law enforcement officer and paramedic for the Maricopa County Sheriff's Office. As EMS coordinator, Jim oversees and supervises 68 EMTs, 9 paramedics, and also oversees 8 National Guard medics assigned to the Sheriff's Office to assist with medical calls for service. Jim has been instrumental in getting AEDs for all patrol units in the Sheriff's Office. He's also started the office's Narcan program for EMTs, which now includes deputies, detention, and civilian staff, totaling over 1,997 trained providers. Over Jim's extensive EMCTP career, he has been involved with harrowing rescues. He once spent the night in the Superstition Mountains with an unresponsive patient. Most recently, he was hoisted 276 feet from Maricopa County Sheriff's Office's Fox 1 helicopter into the Four Peaks area to care for a patient who fell 50 feet and sustained critical injuries. Additionally, Jim teaches basic first aid for the Sheriff's Office Law Enforcement Training Academy. He also teaches post-academy deputies tactical emergency care for law enforcement officers. He has set the training standards for the deputies carrying tourniquets hemostatic agents, and chest seals. If there ever was a paramedic superhero, it would be Jim. Congratulations, Jim, and I apologize for not being there, but scheduling conflicts required me to do this remotely. So take it away, Tracy.
Well, first of all, I wanted to introduce you, Jim Cicilline. He is under my John C. Lincoln Base Hospital. I'm so proud to have nominated him. He's so deserving. What was read is just a fraction of what Jim does for MCSO. And most people don't even know that MCSO has a very strong EMS program. Jim runs that, and he runs it well. He does a lot of community outreach. Yesterday, he was at Scorpion Bay at the lake teaching stop bleed and CPR with the deckhands and with the Scorpion Bay restaurant staff. So he's always doing outreach, community outreach. He's always teaching his own EMS committees at MCSO and his own classes for EMTs. He teaches so many classes, I've lost count of which ones he is. And this is the nicest I think I've ever seen you dressed.
I clean up well.
You do clean up well. So on behalf of the Bureau for the Central Arizona region, which includes the Maricopa Canal and Gila counties, you're selected this year's winner for Central. Thank you so much.
Thank you.
Thank you for your service.
Well, congratulations to all the awardees. A big thank you to David Harton and Julie Vincent who helped coordinate this. This was something that the Bureau came up with. It's kind of late, but we really thought this was a wonderful opportunity as we're starting to emerge from COVID, get back together in person, have events. We really want to take time to recognize all of our EMCTs within the state of Arizona for everything you do. As you saw from the data that Roswell displayed, the EMS workforce in Arizona responds to a very, very large volume of calls throughout the state on a daily basis. And we wanted to say a big thank you for everything. Just to remind you for the awardees, if you'd like some formal pictures, you can go down to the first floor. We can take some nice formal pictures that we will make available for you as well. So again, a big thank you and congratulations. Yes.
Dr. Braden, just real quick, I just wanted to really commend the Bureau on this program. And, you know, as you hear me say all the time when you know, we live in a world where if you do something wrong, you know, immediately, it's great to recognize folks who are doing it. Thank you.
Thank you for that feedback. So, you know, as we discussed at the staff meeting, we are going to try to create something similar for the trauma programs as well. We really want to make sure that we take the time to recognize everyone for all their hard work and know that people go way beyond what their job requirements are and really participate a lot to help improve the outcomes in the state. So big thank you. We do have a busy agenda, so we have our standing and regional council reports. I'm going to try to ask the group to go through those relatively briefly if possible, just so we can make sure we address all of our discussion and action items. I will start with Tepe. Shelley's going to do our Tepe report. Thank you.
This role is vacant and up for nomination and to fill it today. So, the March 16th Tepe meeting, Melissa Luxton gave a presentation on strengthening falls prevention efforts with the help of first responders. Tepe approved their November minutes. Botsalch County presented the Bureau's EMS annual report that showed the 2021 data. Krista Wilson explained the data request auto set age grouping. A share user group was approved. A meeting date is PBA, and then a work group was approved to review the bylaws, and that meeting date is also PBA. End of report.
Thank you. Next up, Brian.
Hey, Education Committee met also on March 16th. We approved the FR CARE grant and naloxone leave behind training as it was presented. We approved training for STR, for EMT airway, supraglottic IGL insertion as presented. Approved updates as part of our review process for the education that's on the website, what should go in your EPCR. There was a training for pediatric seizure and epilepsy by PACES that was tabled at that time. And I'm assuming that will come back in July. Added topic to list future work group ideas for fall prevention mitigation training. Approved the work group to review the bylaws. EMD.
Thank you.
EMD also met on March 16th and approved the minutes from our special meeting on February 16th. Approved an OB-GYN TTGs as amended. Approved TTG appendix and preface pages as amended. Approved drug profiles for ibuprofen and acetaminophen as amended. Those will be going to MDC this afternoon. There was an agenda item for medical direction for hospital-based DMCT practice, and I don't think much had been coming up to that, so that was sunsetted from the agenda. And also approved a work group to review the bylaws.
Thank you very much. Next up for regional council reports, Roy.
A written report was submitted. It's so I won't spend very much time at all on this. I'll just want to highlight that our annual EMS Odyssey conference will be held on June 8th. It is a Zoom conference, and the last day for registration is coming up soon. So if you're interested, there's 7 hours of CE for both nurses and EMTs and paramedics. And if there are any questions, I'd be happy to take them, but otherwise it's all contained in the report.
Thanks very much, Roy. Next up, Sarah, for SAMES report.
Good morning, everybody. Thank you, Dr. Bradley. Our most recent quarterly board meeting was held on April 18th, where we finalized our budget, and we also funded our first EMS education and certification grant. The first grant was awarded to the Cochise County EMS Council. We're very excited about that. In addition, the council approved and funded its annual support for the upcoming Southwest Regional Trauma Conference. With respect to open representative membership positions, we have a recently opened state trauma advisory board position representing the SEAMS region, and we're working with Dr. Tang in collaboration to fill that position. As an educational announcement, a reminder, the Southwest Regional Trauma Conference will be held at the JW Marriott Star Pass on June 29th and 30th. Registration is open. I have submitted a report if there are any additional questions. Our next quarterly meeting will be held on June 20th at 10 o'clock. I'm happy to take questions. Thanks so much.
Thank you, Sarah. All right, next up, Ben.
Report as submitted. 2 brief points. In the February meeting, we had officer elections. Brian Smith, who was voted in as chair, and Eileen Rafters as secretary. Some feedback from our pediatric symposium in March. We were very successful. We had a great time. We'd like to thank Tony St. Mars for all the help she gave us. Thank you.
Thank you. And next up, Rod.
We had our general meeting for May last Thursday. We Javier Hernandez of Somerton Cocopah Fire Department was reelected as the vice president, and Enrique Lopez, San Luis Fire Department, as the treasurer, reelected. Earlier on May 6th, earlier this month, we had a CADS class, that stands for Certified Ambulance Documentation Specialist, and kind of hooks up our paramedics with what Medicare would like to see to keep the checks coming. So we were able to get 50 people through that class. That was a huge help in the region. And we have expended all of our EMTC funds, and we have done 17 full scholarships with that money, and 11 partial we're able to get done. And those 11 partial will be helped out with the remainder of that scholarship in the upcoming fiscal year. But that's a total of 28. And we're able to start a paramedic class up in La Paz County, which is the most needy in the region. So we're really, really excited about that. That's the report.
Thank you very much. Next up is Dr. Woolrich on the line. Okay, Adam will give the report. Thank you.
This is Adam Rodriguez. PACES approved 2 work groups last meeting. We approved one for our bylaw reviews and another one for grant deliverable, which is standing as an EMS pediatric recognition program. And we look forward to bringing EMS agencies on maybe about a year from now when we start populating that list with agencies that would like to participate in that. Also, we have some educations coming online, seizure education and behavioral health slide sets for EMS in particular. And then next Wednesday in the middle of EMS week is EMS for Children Day. And to celebrate that, we are making live a link that will allow EMS agencies to order information stickers, brightly colored information stickers to place on car seat strollers and things like that, where you think would be necessary for responders to find that information at different bases.
Yeah. All right, next for our discussion and action items, if I can get a motion to discuss, amend, and approve the EMS Council meeting minutes from January 19th.
Motion.
Thank you.
Second.
First and a second in the room. Thank you very much.
I didn't.
Oh, Vincent and Brian. Thank you. Thank you. The meeting minutes are in your packet and also in the online version. Are there any recommended amendments? All right. Anyone opposed, please say nay. Any abstentions? All those in favor say aye.
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 Next, we need to nominate and approve a new TEPI liaison. Rebecca Hara was our TEPI liaison for many years from EMS Council. With her retirement, we do need a new liaison from this committee to TEPI. TEPI meets 3 times a year with a standing committee meeting. So that is the first meeting, the 9 a.m. meeting that we have. So I just wanted to see if there is anyone who is interested in that. If you are interested, you can email myself or Shelley, and we will, if we get more than one person of interest, we will figure out how to select someone. But we do need a new liaison. Otherwise, Shelley will keep reading those meeting minutes. But
Figure out a pressure now.
yeah, so please reach out to either one of us if you're interested in fulfilling that role. All right. Next, we want to go to Lahia for a discussion of the new EMS trauma portal.
Good morning, everyone. And Shelley, do you want me to go ahead and share my screen?
I have the slide up.
Okay. So good morning, everyone. It's been over about a month since we switched to our new license management system, a new trauma and base hospital system. It's been going pretty smooth. We've received a ton of applications. We've been able to process a ton of the applications, so the process has been really smooth. Here you can see some of the services that we have available in the new portal. We have our EMCT certifications. We also have our CON applications, air and ground licensure applications, and then we also have the ambulance for both ground and vehicle registration, or EMS training program. And then we also have on the trauma and base hospital side, that's where you can do all your certifications in there as well. So if you have any questions, let us know. Yeah, it's going pretty well, the system. And if you go into our portal, you'll be able to find user guides on how to access the system. We have some FAQ guides as well. We have information on how to create your account. If you had an account in the previous system, you can claim your account. If you were a coordinator, if you were a fleet manager, or if you had an account for your EMCT certification, all of those have been combined. So right now you'll only have one account in the system, which is making everything pretty smooth, and then everything is just going to be in one place. Thank you.
Yes, Brian?
I emailed Marissa about this right after it went online. And so I'm curious as to whether this is a bug that's being worked on, or this is the way it's going to be. But when I look up the MCTs, actions are not showing up. Any action against their certification is not showing up when I look those up like it used to. So now I'm going to be having to call the Bureau to do that. So I'm just curious as to whether that's something that can or is going to be fixed, or whether I need to just plan on making the call.
We can look into that, but it should show what you're used to seeing in the older system should be displayed in the new system. So we can certainly look into that if there's any discrepancy.
I've got 2 people that I know have actions, and so I've just been periodically going back in to check on them, and nothing is showing up. It should stay there for 5 years.
Thank you. That is important. So thank you for bringing that forward. Any
And
further
then-
questions or comments? Oh, go ahead, Leah.
Sorry, and then that's also something we're working with Jeff to see which of the information we can include in that section as well.
Thank you, Lehia.
Any further questions on that item?
One comment. So, CONs and air ambulance was listed on there. We are still working on it. So, we're not quite complete with those applications yet, ready to go live. So we'll be sending out an additional notice when everything is up and online. Those are in progress, and I just want to make sure there's no confusion about what applications are available to actually submit. We're almost there.
Dr. Valley, I have a quick question on that. As an agency administrator, would it be possible to have access to view our personnel's actual cards?
That's a great question. Lehia is the best one on the line to be able to answer exactly what the system can allow. And when folks have reached out, we've directed them to reach out to their regional coordinator, and we've been able to get quite a few people access at the level that they need. I don't know the details of looking at the actual card. Lehia, do you want to talk about the QR codes or the ability to search?
Yeah, and then Shelley, if you want, I can present and then I can go over the sections on the website. So let me share my screen real quick. So once, okay, I'm presenting. So this is the section that you were referring as before as the lookup. You can look up personnel and look for all the information through here. Once you're here, you can log into your account. So once you access the system, you should be able to see all your applications. If you have a role of a coordinator or a manager and are associated to one of the services that we have, you'll be able to see the provider applications. If you're not, you're only going to see the EMCT applications and the training center applications. You can, in here, we have the section to request your card. Once you request your card, you'll get an email with the card, but you also have that card under your documents. And then let me see, because this is our test account. So once you're gonna get your ID card, your new card, and then all the new cards that we have in the system are going to have a QR code. So once you scan the code, it's going to take you to the lookup page with the information of the EMCT that you have. So you should be able to get the name, the level that they have, and the expiration date, and all of that. And what was the second question? I'm sorry, it got caught off a little bit on my end.
My question is, the providers themselves can go do that application, have it emailed to them, but as the administrator for the agency, can I see that for the people that are assigned to my agency?
So if you go, if you go under provider, and then you should be able to access the roster, and then you should be able to access go under personnel, and then you should be able to see if they have a document through them. Should be able to see it.
Hard. That's really the only view that we get now. If that's all that it is, I'm just doing it.
So Dan, what we've discovered is some of the paramedics with recent certifications, some of the EMTs with recent recertifications, you can see their card, but if they're part of the older system, you can't. And
yeah,
so
they have to request it first through us. Then once you request it, it'll be under their document section that you hear for each. These are EMCTs that we have in the system. So if you go under documents, and if they have requested the card, it should be here. But if they haven't requested the card yet, They have to request it first. Yeah, they have to go to my account. It's very simple. It's pretty much, I can show you. If you go under under the applications, if they go under view my applications, all they have to do is click on apply now, and the system is going to do everything automatically. They should be getting the email, and then it's going to be, and that's all they have to do. And then once they do that, it should be in their email, or they can just go into my account, go into documents, and they'll be able to access it right there. And then you can go into provider, and then go into the roster of your company, and then personnel, and then you'll be able to add it here. On that note too as well, if you have new staff, you can add them through here. You can add existing personnel that was in the system, and you can remove them from here.
Yeah.
Yes.
I'm going to go, sorry, we have a very busy agenda. I'm going to go ahead and stop with that if you don't mind. What we will do, it sounds like there is a need for the agencies that probably want to make sure that they have an accurate log of their personnel. So we probably need to come up with some type of kind of FAQ or toolkit to send out to the agencies. So we will work on that offline. So thank you.
Yes, thank you.
All right, I am going to use the chair's prerogative and go a little bit out of order on our agenda because we have a few things we want to make sure that we cover before we kind of, if we run out of time. The first thing, we're going to go to item G. If I can get a motion to discuss, amend, and approve forming a work group to review safety training pieces for ambulance drivers and develop recommendations for a statewide emergency vehicle operation course training.
Motion.
Okay, first from Vince, second from Rod. Thank you. So to give a little bit of background on this, I know that many agencies do have pretty robust EVOC programs that they use to train their personnel. But really, we've recognized a few things recently in the last couple of years that we wanted to bring up in terms of forming this work group. One of which is kind of the risk with lights and sirens transports. We recognize that there's a big national trend looking at this. There's a joint position statement from a number of national bodies that came out looking to try to decrease the number of lights and sirens transports. We've had requests from some stakeholders stating that they really would like to adjust how they dispatch their ambulances because of the risk associated with lights and sirens transport. And then in the news, we've had a large number of incidences recently where ambulances have been stolen, which has resulted in ambulance crashes as well. And so just all these different things coming forward, wanted to bring this up as a topic to see if EMS Council is interested in working on a work group to kind of address this topic at a statewide level. So that is some of the background behind the request. Very good. Is there interest in forming this? I know that we have had stakeholder requests regarding very specifically the ability to adjust some of the CON requirements regarding response times in code 2 versus code 3. But again, we would need feedback from a work group to be able to try to make any changes to that. So that would be one of the things addressed and discussed in this work group. So I see a couple of head nods, but for those on the meeting online, they can't hear head nods. So if I can get some verbal participation, that would be great.
Dr. Bradley, this is Glenn. I think this is good discussion to convene a group on.
Thank you, Glenn.
Absolutely, a great idea. I would remind everyone, DHS had a wonderful program many, many years back with a natural blowout vehicle that we could use in our training process, but you know, it will lead to better, safer driving. So absolutely.
Any further discussion or comments?
We will look in advance because I think it's in the same boat. We will come up with some folks who would participate on that too.
Okay. Excellent. So I hear some support. Anyone that does not like the idea or has concerns or questions? In the chat, Eric Cooper would like to work on this. Okay. So we will make sure that anyone who is interested, we will send an invite out to all of EMS Council. We'll also kind of distribute this widely to make sure we have good participation, understanding that not everyone has a seat at EMS Council, but this is something that affects the entire statewide EMS community. So when we get ready to convene this work group, we will certainly make sure that we get wide participation to reflect all areas. So it sounds like we've got good support. If I can get a vote, anyone opposed to formation of work group, please say nay. Any abstentions? All those in favor say aye.
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 Thank you. That is approved. Next, we are going to go to letter H. If I can get a motion to discuss, amend, and approve forming a work group to review alternative behavioral health transport guidance.
Motion.
Thank you, Vince.
Second.
Second. I don't know who got it first. Brian. All right. Thank you. So to give a little bit of background on this request, this has come up in a number of different discussions recently in regards to options for getting patients to a behavioral health facility. The Bureau has gotten quite a few questions regarding, can an EMS agency take a patient directly to a behavioral health facility? Can you bill for that transport? If you do bill for that transport, can you get reimbursed for that transport? So we're recognizing that there's quite a few different pieces that need to be tackled. And we'd really like to convene a work group to discuss what are the best options for this patient population. We know that some of them, if they've ingested something or have an injury, absolutely do need to go to an emergency department. But the other question that comes up is there an alternative to take these patients directly to a behavioral health facility? And how do we do this in a sustainable fashion? We understand that for EMS agencies, if you're going to transport someone, there's an overhead that has to be covered in order to do a transport. So we need to really look into all the options and recognize that we would likely need to bring in some of our statewide partners, such as ACCESS, as well as Solari, who manages the 988 line and dispatches quite a bit of the crisis response unit. So we wanted to broach the subject to the group, see if there's interest in forming a work group to tackle this topic.
Certainly, I agree that those are topics that need to be addressed. Recognizing, memorializing that is important. So, so much.
Thank you, Franco. Yes.
Yeah, I just want to state that this is the West region. This is a big issue when we're finding ourselves having to transfer these people to 4 or 6 hours. So, limited resource in the West region, this would be a great work group transfer.
Is this including a conversation on transporting already titled patients, or is this just 911 style patients?
So thank you for bringing that up. So there was legislation that was passed last session, and there is a legislative study group, a work group that is currently convening to talk about specifically Title 36 patients. So that is a very separate conversation that is addressed as part of that that new legislation that was passed. So this is really looking at our EMS patient population. So what is kind of currently being seen as a 911 call. So essentially 911 dispatch versus a Title 36 patient, which currently those transports were always done by law enforcement. With this new legislative work session that's kind of evaluating options to look and see, is there an opportunity for other entities? So that is a separate process for that. So thank you for clarifying. Yes.
So this would fall under, I think it's 504, the so-called alternative destination rule, correct? So they have to have decision-making capacity in order to be able to choose to go to another facility, I would assume, since that's what the rule says. So I would participate in work group on that topic.
So it sounds like we've got pretty good support for that. Any further discussion before we take a vote? And again, we recognize that anyone who wants to participate will definitely get your name down, but we will send out once we just decide on a meeting time. This will be distributed widely. We want to make sure we have robust participation from kind of all areas of the state, recognizing this is a statewide problem and not everyone has the opportunity to sit on EMS council. So I will go ahead and take a vote. Is there anyone opposed to the formation of this work group? Please say nay. Any abstentions? All those in favor say aye.
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 All right. Thank you very much. I appreciate having the liberty to go a little bit out of order there. Next up, Anne, I'm going to have you cover, if you don't mind, the trauma triage guideline update.
Sure. Good morning, everybody. Thank you, Shelley. So
I know that there's been discussion over the past year or so about updated trauma triage guidelines that are available for pre-hospital. And we also have a new version 3.5 rolling out. The two of them were not actually synced up. They started at different times. So NEMSIS has put out what they call a hotfix for the software, the various software vendors, so whatever EMS uses to record their EPCRs. It would apply to agencies that are on version 3.5. Arizona is requiring agencies to switch over to version 3.5 by July 1st, so it shouldn't be an issue. The vendors will apply this hotfix. It doesn't have to wait for another, version to come out down the road or anything like that. And there's this guide. I know there's a link in the agenda, and it just goes over the changes between how it's currently documented, which is as far as data collection, with the 2011 label on the right and the 2021 trauma triage criteria on the left. In the middle, you'll see an action column that just describes for each one if there's a change. There's the map to, meaning if you were using that old code under the 2011 code, you would then either map it or send the new code on the left side. Can you go down just a little bit, Shelley? And then others changes include, there are some new values that didn't exist before in 2021. So there's nothing available right now in the 2011 version that would allow you to collect that information. And then there's just some label updates where the code didn't change, but the descriptor will change for the crews. So that top one is E-injury 03. And there's a second page here that Shelley's at the top of that is the same type of crosswalk, but for E-injury 04. So I just wanted to kind of put that out there that this is available to all vendors right now from the NEMSIS website. Agencies who are collecting using the trauma triage 2021 guidelines should check with their vendor to make sure that that patch is available. And then also it's another reason to move to 3.5 because that's the version on which this will be available, and also that we could send it on to NEMSIS for collection. And that is it for that. I don't know if anybody has any questions.
Thank you, Anne. I think just so everyone kind of understands, I know sometimes when we talk about data, if you're not someone who looks at data all the time, it can be a little overwhelming. But this is a pretty substantial fix. NEMSIS 3.5 kind of worked on their update over several years. At the same time, ACS was working on their update to the field triage guidelines, which was their first update since 2011. So those two processes kind of went on simultaneously, but didn't necessarily talk to one another until they both went live. And we have put out quite a bit of training. So the state has adopted the new field triage guidelines for trauma activations. We have put that training out for any agency statewide that would like to implement that training. But recognize that right now, the criteria that individuals were trained on is not in the current 3.4 version for NEMSIS in terms of your trauma activation criteria that EMS selects. So this fix gives an EMS agency the ability to have their vendor make sure that they implement this, which it sounds like they have to be NEMSIS 3.5 compliant. So now when your EMS provider is documenting your reason for trauma activation, it will match your training that you provided them. So I think hopefully moving forward, I'm sure that it will take probably a good 6 months plus to kind of get the two things to line up. We recognize many people have trained on one half of it. Now there's going to be some additional training, but this will give that opportunity moving forward. So thank you, Anne. Any questions regarding that? Excellent. Next, Anne, if you can cover the 3.5 change summary.
Sure, let me put up my presentation. So there's a fair amount of changes between the current version or the older version that we're on as far as data collection, which was called the 3.4. And we are moving, or many agencies have already moved to 3.5. And I just wanted to go over some of the key changes, but more also the reason why some of them are so important. There's many more changes in this, and at the end, I'll just show you a link if you're interested to go to a more in-depth presentation that shows all the changes relevant to AZ peers in Arizona. So some of the key changes and questions that we tend to be asked or want to be able to answer is, for example, what kind of call was it? So type of service requested has had some values updated. They've also split interfacility transport into 3 different subcategories to make it a little clearer as to what type of service and what type of call it was to begin with. And then what type and level of response. So traditionally we had been using primary role of unit, but we weren't really able to use that to answer the question. What the question really is what level of care did the patient receive? So this particular variable is actually the name's being changed, it's being redefined to only being what is that unit and equipment capable of? What is the level of care they actually could provide? And on the next slide, I'll talk about what's kind of replacing this to allow us to look more at the level of care being provided. One of the other questions that is important is when the unit's on scene, did they have patient contact and what happened? So in the older version, we had one variable or data element called incident patient disposition. There were a lot of values. It became kind of complicated. There were things that were missing. We still couldn't really determine what was going on sometimes. And they ended up being almost sentences with commas, which isn't really great for collecting data in the field. So it's been split into 5 different data elements, which I know seems kind of daunting, but the pick lists are much shorter. The items are much shorter. And I think once everybody gets used to it, it'll actually be a lot easier to determine what's going on. So just a couple of examples of that. Now we have unit disposition, which basically is just going to say, did you have patient contact or did you not? And then there is a new one also that is patient evaluation and care. So that is whether or not the patient was evaluated, whether or not they had care, did they refuse evaluation and care, have evaluation, refuse care, evaluation, no care needed, that sort of thing. And then what did the crews do? So this was something I think specifically in Arizona, and I'm sure other states too, that was a little confusing. So before it was really hard to tell who was transporting and who wasn't, because a lot of agencies, for example, hop on the ambulance and provide care. So this one will allow us to determine things like this agency provided primary care, or this agency assumed primary care from another agency, or this agency provided supplemental care, and those kind of things. So kind of looking at who provided the care and what happened. The fourth one that it's been divided into is transport disposition. So this is going to be things like, I transported the patient with members of another crew, or another agency transported patient, but I'm on the ambulance with my crew, and then or no transport at all, which really will hopefully help us sort out kind of what's going on and who's going where and who's providing care. And then let me go on to the next slide. And the last one that was divided into is reasons for refusal. So if a patient refuses care or refuses transport or whatnot, the reason for that refusal can be documented, so that can be examined a little bit more, as you know, if it was AMA or whatever else, that's a place to document it. But if it wasn't a refusal, then they don't have to fill that part out at all, which in the old system, it was kind of there, and it could be kind of confusing if you picked the wrong value. And then I mentioned a little bit earlier that the one of the variables is going to be changing to just the level of care that your equipment and the personnel could provide. There's a new data element that was added in 3.5 called level of care provided per protocol. So it's not related to the billing, and it's not related to, you know, what was the call when it was first initiated or anything like that. It's the actual level of care provided per the protocol of the agency responding, which will hopefully help us answer those questions that seem really simple, but are actually kind of hard to pick out. Another change is we want to be able to ask how ill was the patient before and after care. So both initial patient acuity and final patient acuity data elements have added values. We also have a new variable, which is reasons for interfacility transfer / medical transport. This would obviously only apply to those types of calls, but it's a pick list with general answers that will allow us to kind of sort out why someone's being a medical transport or interfacility transported. And then if a patient was transported to what type of destination and why. So both of these data elements were already available in 3.4 and are available in 3.4, but there have been some added values that really help fill in some gaps. For example, before we had just rehab, and it really meant physical rehab, but it was being used a lot as perhaps substance rehab and things like that. And also they added something for mental health facilities. So that's really helpful. And hospital capability. So this is basically, why did you choose this hospital? Not the one where you say because they wanted to go there, it's the closest, but is there a certain capability at that hospital, like a cardiac receiving center or a stroke center or a trauma center? And before, you can only pick one, but there are cases where you're going to be going there and they have multiple specialties that apply to the reason you're bringing them. And so the occurrence has changed. I think they added some values, and also you can pick more than one if that is the case. And that is it for my overview. Before I forget, I'm going to show you all, have it already pulled up. I'm sure you guys know where our public facing website is. And if you go on the part under data quality assurance, easy peers, and click on this little tab that says V35 transition information, there's a lot of resources. But the top one here that says V35 key changes in 2023, that's going to be a much more expanded, longer and detailed version of these changes that shows exactly like the value changes and things like that if you're interested in reviewing it. Thank you.
Thank you very much, Anne. If you have any questions, please reach out to Anne. I know this is coming up very rapidly. I believe that all the vendors in the state are NEMSIS 3.5 compliant, but just want to make sure everyone recognizes July 1st will be here before we know it. So if you have any questions, Anne is absolutely the both state and national subject matter expert. I just wanted to quickly go back on the Bureau report. We wanted to make sure, since we had so many visitors for our EMCT awards, that we gave them the opportunity to be recognized. We just wanted to cover a couple updates regarding sharing cardiac registry program updates. Oh, thank you for making that clear. So first of all, we just wanted to say a big thank you to our cardiac receiving and referral centers for submitting their 2022 data. We have currently, for the state of Arizona, about 6,300 cardiac arrests for 2022. Greater than 99% hospital outcome data was entered by cardiac receiving and referral centers. So a really big thank you to the hospitals for entering their data. The AEMRC staff, which is at the Arm of the University of Arizona, has been working diligently with the hospitals to get that data, and we look to have that completely closed by May 22nd for the 2022 calendar year. Once all of that is complete, the hospital reports will be run, and then we will start working on the annual report, which is done between the Bureau and AEMRC. One of the big changes we wanted to make sure we highlighted is that the SHARE program will be migrating the data component back to ADHS at the end of June. So ADHS will take over, back over the data collection from the hospitals, from cardiac receiving and referral centers at the end of June. Once that is all set to go, we will make sure there is communication that goes out statewide, but did want to highlight that because that is a substantial change. The data used originally, for those who've been in the system for quite some time, was kind of housed within the department, had migrated kind of externally for data collection to the University of Arizona, and is going to be migrating back to us. So I wanted to make sure we highlighted that piece. Any questions regarding the SHARE program? The Bureau is in the process of hiring a couple individuals to help manage that program. Those positions are posted as well. So thank you for giving me the opportunity to go a little bit out of order there. We do have one other discussion item that I think I'd like to try to table, because I do want to make sure we have time to highlight that adequately, which is the ground level fall data, hip fracture data. This is a report that Vauxhall has put together. I think for those of you that were here for staff, it's some very interesting data, but I think we would shortchange it trying to skim through this in a couple minutes. So if I can get a motion to table that, I would appreciate that.
I motion.
I heard a first and a second. Thank you. And pardon. Anyone opposed to tabling, say nay. Any abstentions? All those in favor, say aye.
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 Next up, any agenda items to be considered for the next meeting, you can please feel free to let either myself or Shelley know. You can reach either of us via email. Again, reminder, we will need a TEPI liaison, as well as anyone that would like to participate in the bylaws work group. I'll call to the public. Upcoming events, the staff agenda, we have quite a few upcoming events that are posted on the Bureau's website. So if you're looking for training opportunities for yourself or your agency, please make sure that you click on that link. We do have quite a bit of opportunities out there. Our next meeting will be September 21st at 10:30, hopefully in this room once again. If I can get a motion to adjourn, please.
So moved.
Meeting is adjourned. Thank you very much, everyone.